Hello, everybody, and welcome to the Tuesday edition of Video Clips. Two announcements I want to cover right now. One is the Cancer Boot Camp that's coming up this Saturday. I'm going to cover things in this boot camp that some of which are covered in Cancer 101 and 201 if you've taken those classes, just foundational stuff. But we're going to talk about a lot of other things that are not covered in those classes, such as treatment options like cryoablation and off-label drugs and supplements and immunotherapy and hyperthermia and hyperbaric oxygen, those kinds of things that people want to know about, and also some of the newer screening tests that are being recommended and some data on those, good idea, bad idea, to help you make decisions about that, and then causes and prevention and that kind of thing. So it's a morning session for 2 hours, then a break, and a 3-hour afternoon session. And if you want to participate in it, call the office and make your reservation. It's 614-841-7700 if you're going to be part of that. And then the other thing that I'll mention is the Nutrition Educator Program classes start the week after next. So this is our alternative to conventional dietetics. And if you're interested in nutrition and cardiovascular disease, nutrition and immunity, and psychology, those classes will start the week after next. So this would be a good time if you're thinking about it and you want to talk to me. I'm available. Oh, and one other thing, I said it too, but actually a third thing, we're still offering conference calls for healthcare professionals looking for career changes and that sort of thing. The next one is scheduled for Thursday, February 10th, I think it is, at 9 p.m. Eastern. And so those are free. You're welcome to participate in those as well. All right, so lots to talk about this week, and I want to talk about today something that is a real big concern for anybody who has a senior citizen in your family, and maybe it's an issue for you if you're a senior citizen. Of course, that's in the eye of the beholder. I refuse to call myself a senior citizen, even though I'm 65, because I feel like I'm 20 inside and in my mind, right? But, you know, we'll just put that aside for a minute. But what I want to talk about is polypharmacy. It's the term that applies to taking lots of meds, and taking multiple drugs is becoming more and more common. A Merck study showed that almost 80% of older adults take at least 2 prescription drugs, 54% take 4 drugs or more, and 36% take 5 or more. Now, there are a whole lot of reasons for this, and it has to do with the way our medical system is set up. It's purged a lot of the good general practice family docs from the system. And these doctors have been replaced by specialists who are more expensive, and also because they're specialists tend to pay attention only to the body parts they specialize in treating. Many older people have a gastroenterologist, a neurologist, a nephrologist, a rheumatologist, and an endocrinologist, lots of ologists, right? These docs often don't pay attention to the whole person, and the result is often patients being referred to even more specialists for more care that's required essentially because of side effects of drugs. The shorter visit, a few minutes, has also become the norm, exacerbates the problem. I mean, you can't really do much other than prescribe a drug when you have such a limited amount of time. Add in the massive investment that drug companies make in advertising, which motivates patients to actually ask for the drugs, and it's no wonder that older people are drugged to the extent that they are. Dr. Mark Williams recently posted an article on Medscape about one of his patients who is an extreme version of what I'm talking about here, but it's worth looking into the mentality of such a person, which is why I'm talking about it here. So this patient was admitted to a hospital for adverse reactions due to polypharmacy, and then somehow got transferred to his facility. And at the time, she was taking 43 prescription drugs, and he reports just about as many over-the-counter medications as well. Dr. Williams reports that the patient's daughter was with her at the hospital for the first visit, and both the patient and the daughter declared that they didn't want any changes in the medications, and they didn't want the urinary catheter removed either, because the patient really enjoyed not having to worry so much about bladder control. They explained to the doctor that they had worked diligently with another doctor to get all this medication straightened around, and they were afraid he was going to change it. Well, in spite of the patient's and the daughter's objections, Dr. Williams insisted on removing the catheter. It posed a constant threat of infection, and he reduced prescription medications down to 15 from 43. Well, while still in the hospital, the patient started declining again, and Dr. Williams subsequently found out that the daughter had given her over-the-counter sleeping pills, which she had seen advertised on television. The daughter was told that she could no longer bring more drugs to her mother and would instead have to deposit them at the nursing station, and then they would have to be approved by the doc. Now, there are so many things contributing to this story, which doesn't yet have a happy ending. I mean, the patient's still taking 15 prescription meds, and Dr. Williams said it's too many still, and her daughter doesn't seem to have learned much from her mother's experience. The patient clearly is not yet out of the danger zone. But polypharmacy is widespread. It's not limited to the elderly. It just is more common there. I met a lot of young people who are over-medicated as well. It's just more impactful for older people who are less able to metabolize and excrete drugs and more likely to have more pronounced reactions to drugs like those prescribed for blood pressure or antidepressants. I mean, weakness, dizziness, falling down, much more common than in younger people. Now, if we're going to change this, I've been a critic of the American healthcare system for a long time, and if we're going to change this, I think that there are 3 or 4 things that have to happen. The first thing is we have got to prohibit drug company advertising. We're one of 2 countries in the world that allow this, and the practice increases sales, which is why they invest billions of dollars in it. Patients ask their doctors for prescription drugs, and they often get them on demand, and then they can purchase as many over-the-counter drugs as they want. There are only 2 countries that do this, and it's a bad idea. And this is just a good example of why. Medicine needs to be decentralized, and referrals to specialists need to be less frequent. Family practice docs and internists should be delivering most of the care to patients and their families and should work in settings that allow them to get to know their patients better. It's significantly less likely, this is my opinion anyway, that a single doctor would prescribe all of these drugs to a patient with whom he or she had a long-term relationship with. And by the way, one of the things that I read a long time ago that kind of contributes to this whole mess too was an article about why doctors overschedule. Why do they have too many people in the waiting room at one time? Well, the reason is because there's no relationship left many times between doctors and their patients. They overschedule because the no-show rate is so high. And so if you go on a day when the usual no-show rate is normal, then you don't have to wait so long. But if you end up being there on a day when, oh gosh, everybody showed up, then the place is packed and the doctor's behind. And I understand why they do it, because if they don't fill all the slots, they can't make a living. But I think that just goes to the fact that we need to have a different kind of relationship between doctor and patient. And I'm hoping that that's in the process of happening now. And then medical appointments have to start including discussions about diet and physical activity and stress and social interaction and other facets of life that can impact health and reduce the need for medical care and drugs. Most doctors today don't know anything about their patients and their lifestyles. They don't ask, and they're not trained to do it. So it's no wonder they prescribe so many drugs, and it's no wonder we have so many people who think that the path to health is lots of doctor's appointments and treatment after treatment after treatment. So anyway, if this affects if this affects you or one or more of your family members, here's what I would suggest. The first thing to do is just get the list of drugs and start looking them up online. I mean, this information is so available. The internet provides everything these days, no matter what you think of it. And really take a look at what the side effects are, and also drug-drug interactions, because if you scroll down on some of these sites, they'll tell you this drug shouldn't be taken with this drug, and you'll be able to spot right away some things that are causing your problems. Don't assume, by the way, that the over-the-counter stuff is okay, and also don't assume that the supplements are okay, because those can have some interactions with the prescription drugs or side effects themselves as well. So after some investigation, a lot of family members find out that their relatives aren't developing new illnesses, they're just drugged too much. And sometimes what happens, and we've seen this happen with a lot of our members, is they'll end up with one or more of their doctors who will consolidate some of the medications, become a primary prescriber. You might have to look for another one. Now, I have to say, I've never met this Dr. Williams who wrote this article on Medscape, but I think he has the right idea about, too much medication, trying to figure out what's going on with the patient, And I really like the fact that he was willing to say, I understand what you want, to keep taking all the drugs and all that, but that's not what we're going to do because it really isn't in your best interest. And so that might sound like it's contrary to what I always talk about the medical profession needs to be more respectful of a patient's desires and what they want, and they sometimes can be real tone deaf to it. But the other side of it is that doctors can't participate, they shouldn't be participating in harming people. And the willingness to speak up and say, listen, I might be an unpopular doctor with you right now, but I'm going to tell you my opinion about what you're doing is it's harmful. And so I've met doctors like that. Lots of our members have found doctors like that who are just really honest. And even if it means some blowback, no, I'm not going to prescribe that drug. No, I'm not going to refill that prescription. So anyway, all things to think about. You're more powerful than you think as you start looking into this on your own. That's what we've been helping people do for years here. And like I said, a lot of people don't need more medicine. They need less medicine, less medical care. Less is sometimes better. All right, that's it for today. As usual, pass this on to anybody who you think might enjoy watching it. And I'll be back to you tomorrow with more news.